My name is Eniola Cadmus from the University of Ibadan, and I'm a CARTA Fellow Cohort 7. Today, I'll be presenting part of my work titled Aging in Place or Stuck in Place: Long-Term Care Preferences of Community-Dwelling Older Persons in a Low-Resource Country in Sub Saharan Africa. As we know, population aging is a global phenomenon, and its aging is associated with increased functional decline, health, and social support needs. The caregiving roles and responsibilities for older persons in the traditional setting in Africa is mainly by the family. However, there are ongoing social changes which are gradually eroding this option of care. These changes include increased female participation in the workforce, urbanization, modernization, and decrease in family size. In recent times, a social policy for long-term care of older persons has emerged. Aging in place is a situation whereby older persons are enabled to live in their preferred place, whether within their homes or communities, for as long as they desire, irrespective of functional decline or disability. However, there is a risk of the individual, rather than aging in place, to be stuck in place if this option is not their preference, or if it's unacceptable or unaffordable or not affordable. This study set out to describe the views and preferences of community-dwelling older persons in terms of the provision for their long-term care and associated factor. A cross-sectional study design was utilized and a mixed method approach was adopted. The study population were older persons aged 60 years and above in both a rural and an urban community in Oyo State, southwestern Nigeria. Data were collected with the aid of semi-structured interviewer-administered questionnaire as well as a focus group guide. Data analysis was done using Atlas TI for the qualitative data and Stata version 14 for the quantitative data. A total of 1,180 respondents were interviewed for this study. Over 60% were females. The mean age was 73.2 years, whereas 72% were aged 70 years and above. Most of the participants were of the Yoruba tribe. Over half were not married or did not have any formal education. Over 70% were living with their family, and more than 2/3 were living in their own houses. Bivariate analysis revealed that factors associated with the desire to age in place were age, sex, home, having assistance within the home, and living in an owned housing. However, logistic regression revealed that predictors of aging in place were for the rural respondents, older age, more than 70 years, the male sex, having some form of assistance at home, and living in an owned house. On the other hand, for the urban respondents, predictors of the desire to age in place were older age and home ownership. The focus group discussion revealed that the desire to age in place and the preferred setting were mostly based on the traditional expectation of reciprocity. Interestingly, institutional care was also acceptable as an option for the long-term care provisions of older persons. In conclusion, this study revealed that older persons prefer to age in place but are open to other options such as institutional care, especially in the event of functional decline. This information will assist targeted action for the provision of community-based long-term care for older persons in Nigeria and similar resource settings. Thank you for listening.